Your back affects your daily health. Welcome to another installment of Your Spine, Your Health.
Last week, we had Dr. Ken tell you about T3. Today, we're talking about T4, just sits below T3, and of course, joins with T5. And if you've seen our previous segments, you're now starting to see that the whole image of the spine is starting to shape. The importance of the spine includes movement and function, as we've said. One of the things that happens from birth onwards is a condition known as scoliosis. Now, scoliosis is simply a curvature of the back. So what's the concern about scoliosis? Parents need to look at the development of their children from a point where the body is growing symmetrical. That means the right shoulder is the same height as the left. It also means that if you're looking straight on at a person, the middle of the head is actually over the middle of the neck. Some people, just to exaggerate, they might be sitting there like that. Why do these shapes change? It's because from the pelvis on up to the spine, there's a curve. Where this curve gets severe, sometimes surgical intervention is necessary to protect the organs inside us. But for most people, the issue of scoliosis can be developmental, meaning how you grew. It can also be subsequent to a trauma or an accident. And this you'll see if there's been an injury in the lower part of the spine and the vertebrae are no longer square, they may sit a little like this. Well, naturally, mechanically, everything else has to spin off to that side. The other aspect of scoliosis can occur from something as simple as the leg length not growing the same way. In other words, one leg is slightly higher than the other. When that happens, the pelvis that sits on top of each leg, it too will be slightly off-center. And what happens next? You guessed it, the whole spine starts to wander over to one side and straighten out. The curve is necessary so that our head sits over the middle of our pelvis. So don't think of the scoliosis as a health problem. Think of it as a sign of an area of the body, in this case our spine, that needs to be investigated to find out why these uneven shapes are there. These are important to understand for your health and well-being. Exercise is often helpful to counteract the effects of this, but an examination from your family chiropractor is important if you start to see these developmental changes that show being off-center occurring. For more information on these topics we have discussed, be sure to contact your family chiropractor. Prevention is also about early correction. Remember, your back is important to your daily health. Join me on the next show as we continue our journey down your spine.